All right, another day, another episode of the Victory Degree podcast. Today we're taking a slight turn down the medicinal route. So we're going to get into a bunch of topics about medicine, about sports medicine, about athlete recovery, all of that good stuff. And I have the pleasure of welcoming our guest here today, Dr. Jesse Morse. Jesse, thanks so much for coming on.
My pleasure. Thank you for having me.
Absolutely. I figured a good place for us to start might be a little bit of a difficult topic, but I think it'll give the audience a little bit of an insight as to who you are and your experience and your journey to how you got to where you are. So tell me a little bit about the story of you breaking your neck and being inches away from death.
Yeah, so many don't know that one actually. So I grew up in Massachusetts. It was a senior high school, St. Patrick's Day, and black ice, a lot of snow, and the street was basically like an L. And my cousin was driving, and we were going from one place to another, and we were following someone, and he didn't really know the street. And instead of making the L, the black ice took us and we hit a telephone pole and we did a bunch of flips. And I got ejected and I woke up in the ER. And then it was pretty crazy. I had 4 cervical vertebrae that were fractured. I had a broken arm. I was actually walking around at the scene, which was kind of interesting. And then by the time I woke up again, it was in a C-collar, one of those little plastic things, and I had a fracture on my right arm, through and through, so I needed 2 metal plates. And my mom actually worked at the hospital that I was at the time, so I happened to have the team doc for the Red Sox do it. And then they said you got super lucky. You know another inch or so, you probably would have been dead, and then even a millimeter or two. Um, in either direction, I probably would have been paralyzed. But so I got lucky in that regard, and I rehabbed for several months or whatever it was, and then that was it. I didn't need surgery. I didn't need what they call that halo, where they screw that thing into your scalp. Um, and I ended up leaving because I couldn't really handle the cold much anymore, and I ended up coming down to South Florida for undergrad, and that was kind of, the rest was history. But that kind of pushed me to medicine, the care. I appreciated just that, it's a lot easier when you're a patient first, and you get that type of care, and you understand what small things can translate to care. So it ended up indirectly working for me and kind of pushing me more so towards medicine than I did before that.
So now you're a sports and family medicine physician. You specialize in regenerative medicine.
Yep.
You're a professional athlete consultant. So I say all of those, all those titles, but when you boil it down, what do you view as your responsibility?
I'm just a patient advocate, to make
Hmm.
it easy. I mean, one of the issues I see with medicine, and one of the reasons why I chose the path I've chose, is because, like, coming out of fellowship, I did my fellowship in sports medicine at USF in Tampa. And after I finished there, I went to an orthopedic practice kind of north of West Palm Beach. And, I was seeing 20, 25, 30 patients a day. And I'm like, this isn't medicine. Like, I have 5 to 10, maybe 15 minutes with each patient. I'm like a chicken with my head cut off. Like, I really can't sit down and actually change and improve the patient. It's like, hey, can I give you a cortisone injection? Do you have a fracture? Do I prep you for surgery and coordinate with surgeons? Like, it wasn't medicine, in my opinion. It was just like, it was just chaos. And I'm like, this isn't medicine. So I wanted to go to a place where I can actually sit down and the patient can tell me what's wrong. I can evaluate them. I can ultrasound them if I need to. I can actually give them options that aren't a band-aid or surgery. And I fell in love with regenerative medicine and quote unquote stem cell, which most people know it as. And the problem with it is that this isn't common, right? This is not covered by insurance, so it makes it much more challenging for people to come see you. Um, and I can't take insurance because I spend an hour to an hour and a half with each patient. Like that's quality of care. Would you rather see a doctor 10 times with 15 minutes each, or one time and give an hour and a half? And actually feel like you just had an you got all the thoughts out, you got all your questions out, you got an appropriate plan, you have clarity on the injury or whatever the issue is. And it's almost concierge, and whatever it is. But at the end of the day, my goal is to provide more information to the patient than they came in with. If they want to do an option that I present and that I perform, great. But if not, then at least you know more that maybe you can't find on the internet. Maybe your traditional ortho or sports med doc doesn't talk about, or you don't know much about. You may know snippets about peptides or about, different types of PRP and stem cell and all these different modalities or IVs, but it's hard to get an accurate piece of info that's well guided and well researched uh, with a 10 or 15-minute appointment. You just simply don't have time to have a decent conversation because, like, sorry, I got to go. And you have 5 other patients waiting around the corner. And it's just like this constantly playing catch up is just like, that's not medicine. It's just not me. So I was like, I'm going to break the barrier and I want to help my patients. Unfortunately, I can't help as many as I would like to because, the barrier of it is predominantly financial. But if people want to actually address a problem and have the luxury of being able to afford it a little bit, you're going to be struggling to find a place that's going to give you more care for in one visit.
I think you're quoted as saying that the healthcare in the United States is more reactive than it is proactive. Can you
Oh,
explain what that
definitely.
means? And it sounds like it ties into kind of what you were just describing.
Yeah, I mean the problem with medicine in America, there's a lot of problems, but uh, I mean if you think about it, we don't really do anything proactive. Everything's like, oh, you got sick, let me come treat you. Or, oh, you have cancer, let me fix that. But it's like, we do like 1 or 2 screenings. They do a little bit of blood work. It's probably like 10% of what actually should be done. Um, Nothing is done proactively. You don't scan people to see, hey, how is that shoulder holding up before you actually tear the rotator cuff. You're not, everything is, let's wait for it to break and then we fix it. And I don't call American healthcare. I call it sick care, because the way our healthcare system is designed is it's all for profit. So the problem is if you're an insurance company, why would you want to treat something? It's one and done, and then you lose that cash cow. You want to keep them sick, keep them managed so that you constantly have a source of income. That's the problem when you have a system that is set up in a for-profit industry. They don't want to get you better. They want you to maintain to be sick or not ideal so that you continue to pay. If you end up spending your deductible's $2,500 and you say you spend $5,000 this year, which means it's $2,500 coming from the health insurance company, guess whose premium's going up next year? They lost money on you, and you're a bad patient to them. But no, you're just a patient that spent some of their money, and their goal is to deny everything, i.e., MRIs, medications, whatever, so that the more they deny, the more they make. That's why it's so difficult to get this MRI, get this med approved, because it costs them money. Healthcare cannot work in this way because it is so reactive, and that's the biggest issue I have with it. I hate it because I do not want insurance company dictating what the patient needs without even knowing what the patient has. It's like, how can you possibly tell me what this patient needs? You don't know anything about, what they're dealing with. And you're always going to tell me, no, you can't have this, and tell me, no, you can't have that. Like, that's silly to me. Uh, so that's the issue I have. I try to be as reactive, but also as proactive as possible. Obviously, you come in with an injury, then it's reactive. But what if I can address that and also prevent it from getting worse, i.e., arthritis or something that's relatively logical and straightforward. But no, I just want to be reactive. I put a cortisone shot in there, send you on your way, and wait 3 months and wait for it to come back. And more often than not, it's going to be worse than you presented before, because what did you do? You tricked the brain into thinking there's no injury. You basically just said, hey, we're going to kick the can down the road. We're going to decrease the inflammation temporarily. We're not going to structurally improve the tissue at all. You're going to continue to push because now you don't have that reminder that you have pain. And now you're going to make a mild injury moderate. And when you come back, that second cortisone shot, or third, or however many it is, it's not going to work because the body already know how to figure it out and get rid of it. So eventually, what are you going to need? A replacement. That's what you're going to need. And that, and that's the problem, is that this system is flawed.
So let's combine topics here for a second. As we kind of, as we kicked off this episode, we talked about how you are a specialist in regenerative medicine. You also work with a lot of athletes. And so I know nothing about regenerative medicine. So when you talk about stem cells, when you talk about PRP, like I'm lost. So can
Yeah.
you quickly explain what stem cells do, what is PRP,
Yep.
and then why would that maybe be beneficial to an athlete?
So the good thing is they're beneficial to everyone. So I'll start with the basics. So PRP stands for platelet-rich plasma. You basically take blood out of the arm, you spin it in a centrifuge. The first round after you spin it, it separates the red blood cells from the plasma. Growth factors, we'll call it. The red blood cells you don't really need for any healing, so you throw those away. You then take the plasma, and a good, what I call kit, will then spin it again. That further concentrates the growth factors in the plasma even more. The platelet-rich plasma, which is the strong stuff, which is usually which we use for ligaments and tendons, will settle to the bottom because it's heavier. You then separate that by basically pulling out the top layer, which is platelet-poor plasma, which is good for muscle but doesn't have usually the potency for ligaments or tendons. And then you extract the platelet-rich, and you inject that into various areas, whether it's ligaments, tendons, muscle, whatever you're trying to fix. And that sets off a chain reaction, basically saying, hey, body, you have an injury here. Here's what you need to fix it. Go to work. Stem cells are basically the the bigger, more potent version of that. We used to think Arnold Kaplan was the original person that identified what we call mesenchymal stem cells, or MSCs. And he thought initially that they were going to just create all these crazy cells, these beautiful things that would just build all new stuff. But in actuality, he came out about 10, 15 years later and he said, you know what? That's not what's happening. Mesenchymal stem cells should actually be called medicinal signaling cells. And I like to call them the ultimate traffic cop. Here's what you need. You go over there, fix this. Hey, there's an injury over there. You go over there and do that. So when you inject that area, you basically tell the body, hey, you have an injury here. I'm going to create some local inflammation. I'm going to make these growth factors available. Go in and do work and actually heal the tissue to the best of your ability with these tissues. The problem with our body is we only heal up to about 85% or so. And the issue is we do not have the luxury of healing ligaments or tendons, which pretty much control most of the body, because the ligaments and tendons have a very poor blood supply. Muscles, for the most part, have a great blood supply, and bones, for the most part, heal really well. So those you don't really need to help out a whole lot. But ligaments, which are basically bone to bone, like the ACL, or tendon, which is basically muscle, bone, tendon, say your Achilles, have a poor blood supply. So it's the weakest link, and that's usually where the injury happens. Think of a hamstring, think of an Achilles, think of a rotator cuff. So the problem is those don't naturally heal. The body puts some scar tissue where the best it can put. Sometimes it's calcium, which basically turns into bone, like arthritis or bone spurs. And that becomes the weakest link, because that tissue is not as strong or not as flexible. So where is it going to break down? It's that breakdown at the earliest or weakest part, and that's where it's going to be. It's going to be at the scar tissue. So you keep breaking down this same tissue. That's why you roll your ankle and you sprain it over and over again, like it never heals, because it really doesn't. The body just basically uses a piece of patchwork. I usually describe it as a big a kind of pothole in the city, and the city comes in and puts asphalt over top it. It's never as strong as the original. You can see that there's a difference, but it does the job. But whenever you have enough cars roll over that pothole again, it becomes a new pothole, and then it does the same thing over. Well, my goal is to basically drop as strong of cells as I can into that pothole and heal it as much as I can. I'm not going to get it perfect like when you were 15, but I can make it significantly stronger and be able to handle the rigors of everyday life. The stronger, the worse the injury, the stronger the product you need. And this is an emerging field, but it's been around since the late 80s, or at least PRP has been. And it's been evolved, and there's different versions. You can get some from your bone marrow, which comes out of basically the back of your hip. You can get some for your fat. Fat has fantastic stem cells. And then they have what I call growth factor lines, which are some people consider taboo. They're taken from amniotic tissue or an umbilical cord, or different types of cells that are maybe manipulated in some capacity, many of which are not available in America. But each of these have a different mechanism of action in terms of potency, but they basically all have the same goal. You're trying to heal or strengthen the tissue as much as you can using a massive amount of growth factors. When you compare something like bone marrow, you have a combination of mesenchymal stem cells, or MSCs, but not too many. You have more HSCs, which are basically what makes your blood cells, and so on and so forth. And then you have something called IRAP, which is this super strong protein that kind of makes it really work. The problem with bone marrow is that it declines in potency as you age. So each decade it becomes a little less potent. If you take cells or growth factors out of a placental tissue, they're as strong as you're ever going to be. They were just making organs and tissues and bones, so they are really, really, really powerful. Traditionally, they get thrown away, so you don't really ever get to utilize them. And if you were to take something like PRP, it's nowhere near as strong as something like bone marrow or any of the stem cell lines, but it has a lot of growth factors in it. And the higher platelet count you have, the more it concentrates and the more growth factors you have.
So if we take that and apply, because right off the bat, I think of the phrase injury prone. Like I hear that in sports all the time across every league. There's certain players that are more injury prone than others. And I always thought that was more so to do with genetics, that there is some genetic makeup that makes you more susceptible to injuries, to re-injuries. It sounds like that there's also just a natural factor. You're talking about the patchwork that your body does and never fully heals, with certain injuries. So I guess what would be kind of the balance between those two? How much of it is genetics, and then how much of it is just the body's natural, I guess, ability or lack of ability to repair itself properly?
It's a good question. There is a combination of both. One of my favorite phrases is the greatest predictor of future injury is past injury. And the
Mm.
reason why I say that is because you have that patchwork, you have that scar tissue development where you are at a greater risk to re-injure that, whether it's from direct re-injury of the same injury or a compensation pattern, where that injury was causing this area to be weaker, and as a result, I'll give you an example. J.K. Dobbins. When J.K. Dobbins tore his ACL, he then had to use his good leg a lot more because he couldn't push off his bad leg. Well, that unfortunately caused his Achilles to have to push a lot harder. And unfortunately, when he came back and he started to use that because he wasn't fully back, he then tore his Achilles on the opposite leg. That was a compensating injury. So that, but then you have a genetic variant and never a genetic part of it. And the majority of the professional athletes I see, the reason why they can become professional in some sense is because they heal so fast. They heal ridiculously. It's like crazy. Like what takes people 3, 4, 5 weeks, they do in 2 weeks. They're like freaks. And yes, some of that is genetic variants and what we call alleles, and that's kind of what I've started to be studying lately. And as genetics has become more, more cost, reasonable, you can actually do a full genetic panel, or pretty much the majority of what we have available, for like $600-700. and you can see which genes code for which, there's about 10 or 15 of them that code for different parts of, hey, this one you have a higher risk of soft tissue, this one you don't heal as well, this one. So when you put them all together, they say, yeah, this person just doesn't heal as well. They don't have all the coding to do it correctly. And whereas this one has like a super gene, they have all of the alleles or many of the alleles that allow for healing a lot better. I mean, it doesn't mean it's perfect, but it gives them a better shot than someone who has a poor version of that same gene.
So this is going to sound like a dumb question, but when it comes to toughness and when it comes to being able to deal with injuries, like the first player that comes to mind is Matt Stafford. The guy seemingly is injured almost every play, but somehow he finds a way to fight through it and continue playing. There's that video of him when he was on the Lions. I think he might have torn his shoulder or something, but then he came in on the next drive and threw a touchdown pass. The guy is ridiculous. We saw it in
Yeah.
this year's playoff game again. When it comes to toughness and like dealing with injuries, again, it's going to sound like a dumb question, but is that a mindset? Like, or is that part of your genetic makeup to say, I can just deal with this, maybe better? I don't know.
I don't know if it definitely exists. I don't know, why it exists per se, but Stafford is a fantastic example. He has one of the craziest injury histories you'll ever see. DeAndre Hopkins is another example. Mike Evans is a great example. That dude, unless you cut off his leg, he is not getting off the field. If he misses, it's usually from a suspension or concussion or something that he can't override. I mean, he's played most of the season with a high ankle sprain that he should have easily sat out. But it's just who he is. He compartmentalizes that pain and knows he's not going to be at 100%, but does what he can to still be effective, or an expensive decoy. But some guys, they learn how to push through. Obviously, there's some injuries you can't push through, fractures and so on and so forth. But in general, I've noticed some guys, that's just who they are. The colloquial term would probably be dog. But in general, there are certain players that are just known. They're gonna fight. They're gonna push. You're not gonna get them off the field unless they literally get pulled off the field for safety reasons, concussion or something like that.
Speaking of Stafford and speaking of, you mentioned injury histories here a couple minutes ago. I believe you went back and looked at almost every NFL player's injury history, and I think you compiled a list. What what prompted you to do that? Because I think, and don't take this the wrong way, I think most normal people probably wouldn't sit down on a Friday night and be like, you know what, tonight I just want to go through and look at everyone's injury history. So please tell us that story.
So that happened in 2021, somewhere around there. It was in the off season, probably I'd say February, March. And then I started looking at, so basically what I did was I took every relevant NFL quarterback that was active, every running back, wide receiver, tight end. I didn't do like the fourth string running backs. Like I had a line because it was just getting ridiculous. But I basically, because my primary issue at that time was, how can I project someone's future risk if I don't know what injuries they've had? Obviously, we'll never know all the injuries a player has. It's just not realistic. Many of them aren't even discussed. Players that come to me, I don't have to report to anyone. No one knows what that injury is except for the player and me. So that type of thing would never show up on an injury report. But if they were on an injury report in the NFL for insurance reasons, they have to be on the report, namely other things. But there's a reason they were dealing with something. Even if it wasn't enough to keep them out of the game, that means they were still dealing with something. And sometimes they'll say like knee/rest, and those I don't really comment on because they're basically saying we're giving this guy off. But in general, I wanted to identify as many things as I can, because each of those plays a role in future injuries and future. I'll give an example. Anthony Richardson this year came in, and really no one knew his history a whole lot. He had an insane medical history. He had multiple injuries to his throwing shoulder going back to his high school years. And the problem with the shoulder is that the location of the shoulder where he injured is scar tissue, all the scar tissue. So while yes, he could throw because it would heal, that scar tissue was never as strong as the original ligaments. So when he landed hard on his shoulder, most people who have never had injured their shoulder, maybe a type 1, maybe a little bit of a type 2, and he probably would have missed a couple weeks at the most, and he would have came back. But because his injury to his shoulder was so already significant, those ligaments were already so patchworked. Once he put that shoulder to the ground, he got drove into the ground, he fully tore everything. That was it. And you could have rolled the dice, but it wasn't worth the risk. You had to basically repair him at that time. Now, if you didn't know about his injury history, you would say, well, that's just dumb luck. It wasn't dumb luck. There was a writing on the wall, and everything just happened to play out in a certain scenario, and he had a higher risk of re-injury, just like Julio Jones and his hamstrings or Debo and his hamstrings. There's certain players that have a significant history of one or two, or Christian Watson for that matter, uh, that these guys just have had specific issues with certain body parts, and they're known to re-injure that body part. So I wanted to take the guesswork out of it, and I just literally went crazy. And the good thing is I really don't have to add a whole lot because there's only so many players that get added on each year. It's hard, 5, 10, 15 years ago because they didn't have to do a lot of reporting. The internet really didn't exist. There wasn't really a whole lot on paper. There wasn't good reporters asking great questions, and there's 20 reporters for each team. So you get a little bit of a different answer from each of them, and now you can kind of piece it together. But over the past 5 or 8 years or so, they've been much, much better questions, which allows me to interpret those answers and say, well, he describes it this way. This is likely what it is. Rarely do they say, yes, this is a type 2 AC sprain, which is what Jamar Chase had a couple of weeks ago. But usually it's more, hey, it's this. He can't go this week, but he's okay. He's not going to be a month. Then you can kind of figure out and read between the lines. But when you build that injury history, and we have my company, the Fantasy Doctors, has the most extensive one, you kind of get an idea of how risky. Obviously, there's fluky injuries that happens, but in general, you can see this guy's had 15 injuries and he's missed one game. Like he dude fights through injuries, and then you have guys that have 8 injuries and they've missed 20 games. So you're like, yeah, this guy has a tendency to miss games regardless of the injury. Elijah Mitchell is a guy that comes to mind. Rashad Penny.
Right. How much weight do you think, let's say hypothetically you were able to give out a copy of your injury history report to every team in the NFL. And so now every team is looking at what you've compiled, and they're sitting there and they're saying, well, listen, let's say you were the Colts before they drafted Anthony Richardson. Like, listen, this guy has had multiple shoulder injuries. He's had multiple injuries throughout his career. Maybe we should rethink this pick. From your perspective, like, how much weight do you think teams should place on injury histories? You mentioned that there's outliers on either end of the spectrum, maybe somebody
Yeah,
who, typically plays through injuries, but it seems like that there's a correlation between the history and then being able to predict future injuries and availability.
there's a little bit of a loose one, yes. I'll give you 2 examples. One that's upcoming, that's going to be interesting to see how it plays out, and another one that has already played out and has had a very interesting NFL career. Deshaun Watson tore his ACL coming out of college, tore it almost 2 years later, the other side. So was he at higher risk? Yes, and he showed that, obviously he was high risk, and now he's had a couple of crazy injuries, obviously, in addition to his other stuff. And now you have another player that's about to come out, presumably, Michael Penix, that has a crazy injury history. So it'll be interesting to see how much they take that into consideration. I'll give you another example that kind of has flown under the radar, but when you look at it, you may say, there may be something to that. Zach Wilson tore his labrum in his throwing shoulder pretty bad when he was at BYU. I know he had it repaired and he came back and he looked good in his whatever year last year he was there. Is it possible that is somehow impacting him at the NFL? Maybe, I don't know. But there's different injuries that play a role. Drew Brees was the one that defied the odds with the crazy shoulder injury that no one ever thought was going to have make it. Adrian Peterson obviously defied the odds with his crazy knee, but it's been 15, almost 10 years, actually 13 years since then, and we've only had one or two guys actually do good as an NFL running back after an ACL tear. Brees Hall did it this year, and that was the first one that comes to mind. Saquon didn't do well. Dalvin Cook didn't do well. So it's been a long time. Like, you can see most of these guys have a tendency to struggle after XYZ injuries. Why do certain injuries to certain positions really struggle? Look at the Achilles for running backs. They've all been awful. The only one that's been relatively decent is Donta Foreman, and he took 4 years to come back. That's insane. That's a lifetime. The only other one that's been half decent is actually Justice Hill, kind of flown underneath the radar. But like, has James Robinson done well? No, he's on what, 3 or 4 teams already. Cam Akers tore his other side. I don't think it was the same side. I think it was the other side. So it's like there's certain injuries that are like, and then there was a kid coming out of Minnesota last year, running back. I forgot his Muhammad Ibrahim, I think it was, who had tore his Achilles, did absolutely nuclear in his last year there, but no one even bothered with him. Whether it was because he wasn't talented or because they were concerned about the ability of that Achilles to hold up, I don't know. But I think the more information, and most of the stuff that I have should be available. I mean, whatnot, but in general, it at least gives them more informed decisions. I don't know if they're using it to that extent, and they should be, because these picks are very valuable. You miss a guy like Puka Nacua. I mean, you're like, what? How do they miss that guy? Like, he was ridiculous. But if you look at the stats and you pull out and you highlight the analysis, you're like, yeah, the dude belonged up in that tier. He just didn't get that way, and the Rams got a steal, literally. But it should be a significant component. But the problem is, I look at injuries differently. I'm not a surgeon. I don't look at them surgically. I look at them from compensation patterns, from how is that injury, and because I study this stuff so much, I understand how it impacts them. They may look at it from a perspective of, hey, can he play tomorrow, or is he still going to be semi-effective? Maybe, but that may not be the right way to look at it. What if I told you he's going to lose 5 or 10%, and that may make him from an elite number 1 first-round player to a third-round pick? What if I told you that Kirk Cousins, because he tore his Achilles on his power side, is going to have trouble throwing the ball with velocity compared to Aaron Rodgers, who's on his non-throwing or non-dominant side and is probably going to be fine? Same injury. Rodgers is obviously a little bit older, but one may actually struggle a little more than the other. And to most people who you ask, you'd be like, oh, they're going to do fine. He's going to be fine. But what if he doesn't, and you just sunk 25, 30, 35, 40 million dollars into him?
I love
So
this insight.
that,
Yeah.
that's the tricky part, is that, like, and I have people that I kind of sometimes ask this question. I'm like, stop by your friendly orthopedic surgeon and ask them about XYZ injury in the middle of the NFL season. They're going to look at you like you got 4 heads. Unless they happen to be a diehard fan of the team that you happen to be asking about, there's no way they're going to have good insight. They'll give you some brief general comment, but they're not going to be like, well, yeah, he practiced today. He has a history of missing 3 games with this injury. This team is very aggressive in their approach. He's going to play on Sunday. There's no way. There's no way they would say that, just because it's very hard to keep up with this stuff. It's very difficult to understand which teams are aggressive, i.e. the Eagles, and which teams are conservative, i.e. the Packers. And when you start to use these little tidbits of information, yes, he might be on the field, but he's going to be a decoy. His prop bet should be under. It's not worth the risk. So you start looking at it from a different perspective, and then you start to see it gets complicated, because it's not just one player. My list on average during the season is 75 to 80 players, and I'm not covering any defensive players or any offensive line. It's just wide receiver, tight end, running back, and quarterback. That's it. And then I'm not even covering the fifth string running back that's on special teams. So this stuff is insane, and it's complicated. There's a lot of moving parts, and you have to seek out trends. You have to understand biases. You have to understand um, just how certain players function. How I can say, yeah, Mike Evans is going to play this week, and I don't even need to see what the injury is unless it's a concussion, because that's just who he is. Whereas another player, I'm like, I don't know, but we're going to have to monitor the practice and go from there, because I know how Mike Evans and how some of these guys are. DeAndre Hopkins came back this year after a confirmed high ankle sprain, didn't miss one game, didn't miss a single game. I knew he was going to struggle for about 2-3 weeks, and he did, but he didn't miss a game because that's who he is. So when you can spot these things and you know their injury histories, you can identify some of these things. But unfortunately, it is exhausting. It is a significant amount of work, and you really have to be passionate about it, because most people aren't going to be willing to spend that much time week in and week out.
I want to read you a stat that just blew my mind. I stole it from one of your tweets, and then I want to get to Rodgers because I think it's a fascinating story, and I'm eager to hear your opinion. You tweeted that 15 of the past 16 running backs who tore their ACL failed to be relevant in their first year back. That just blew my. And you mentioned Breece Hall was the only exception to that.
Yep.
I mean, that's crazy.
It's true. Unfortunately, when you look at all the players, and when I say relevant, it's more ill towards fantasy, but and I think it's a combination of several things. One, their body isn't completely ready. Two, they have a higher risk of re-injury or compensating injury. Three, most of the times the teams are going to baby them and not give them the volume they need to be an elite player. The more complicated the injury tear, the more challenging it is to come back. So I'll give you an example. J.K. Dobbins and Gus Edwards happen to have the same exact injury, which is insane because it happened in the same year and they're on the same team. Obviously, their genetic profiles and their combine scores and everything are completely different. Dobbins is expected to be a freak, and Edwards really was even similar. But if you look at the numbers, Edwards kind of did a little bit better. Yeah, Dobbins had better games, but he didn't play as much. But the problem is neither were really relevant that year. You couldn't draft them in fantasy. I mean, neither played until like week 8 or something. So, and even when they played, they're like, yeah, they're getting 8 touches or something. So it's not like, oh yeah, this guy just took over and he's Christian McCaffrey. No, like that's the hard part. So more often than not, I'm willing to bet against. And if you bet against Javonte Williams this year, you probably would have won. And he didn't do the best, but he didn't do awful. But Breece Hall was an anomaly. Look at his last 3 or 4 games. That was what boosted him up. He had an incredible season. He managed to stay healthy. He had an offensive line that was awful. He played with 3 backup quarterbacks, lost Rodgers on the 4th play of the year, and he still had an incredible season. Now, most of that was because he was getting stupid volume that isn't normally realistic unless you're McCaffrey or something of that, someone of that ilk. So he was the exception to the rule. But if you look at the last 5, 6, 7, 8 running backs that came back from ACL, none of them did well enough to be like, yeah, he had a ridiculous season, or even he had a really good season. He was okay. The second year, usually much better. Usually.
I lied. I'm gonna save Rodgers for the end. I want to get to longevity because I think it's fascinating. And I had one of our last guests was Rajiv Ram, who he used to be the number 1 doubles tennis player in the world. Him and his partner. I think now he's 4 or 5, so still amongst the best. He's nearing 40 years old. We see it across almost every sport. You look at Tom Brady, LeBron James, Rajiv, who we just had on. It seems like athletes are playing longer and longer, and they're playing at their peak. It's not just like, Brady wasn't a bum his last couple of seasons. He was still Tom Brady. LeBron James in year 20 is not a bum. He's still one of the best players in the NBA. Rajiv Ram is not a bum. He's still top 5 in the world at his craft. So Can you give myself and the audience an appreciation for how far sports medicine has come that's been able to essentially enable this longevity, this golden era of longevity that we're currently seeing?
Yeah, I mean, if you think about it, 20, 30, 40, 50 years ago, most NFL players didn't last a whole long. The game was completely different. Lot of narcotics, a lot of turn the other shoulder. They didn't even pay attention to concussions. Most of the guys probably didn't even live until their 50s or 60s, unfortunately, just because it was so harsh. Now you have what? Obviously, the rules kind of tailored to saving and preserving quarterbacks, I guess rightfully so. But Brady, you have Rodgers, Cousins is up in his 30s, Stafford's in his relatively late 30s. All of these guys, kickers, they're kind of the exception as well. But most of these guys, they're not genetic freaks. Like Tom Brady, who's behind me because I grew up there and watched him pretty much my whole life, is not a genetic freak. I mean, look at his just. If you think he's a genetic freak, watch his combine rushing and throwing. It is the craziest and saddest thing you will ever see. He's brilliant and knows how to dictate a defense like no one else, except for maybe Peyton. But that's what made him brilliant. It wasn't his genetics, but it was also he knew how to prevent injury. He knew the importance of pliability and flexibility and nutrition and sleep and certain supplements and certain modalities that help keep him in optimal shape. LeBron and I are the same age. He's still beating up kids that are 15, 18 years younger on the court anyway. Like, and it's crazy that he can continue to defy odds for several reasons. Those guys play 50, 60, 70 games a year. Like, that's a lot of volume. It's been quoted that LeBron's probably spends I bet you it's closer to 2 mil a year on his health, and whatever the price is, it's worth it because it's probably 10%, 5%, and it allows him to continue to dominate at a very, very high level. We have access to amazing things. You have to know and trust and be willing to go out of your way and to spend a lot of time rehabbing. When I see pros that I see, probably a couple a week, depending on the time of the year, that we're about to get into busy season for NFL because they're all about to come back, and usually February, March. And what I noticed is that most of the ones I see are 27, 28. They're not 22, 23 because the 20 and I meet the 22, 23-year-olds, but they all think they're invincible because they've gotten by on talent. Their accumulation of injuries usually hasn't started yet. It can, and some of them do. And most of them aren't super in tune with their body. I met CeeDee Lamb, I think it was last year, and he blew my mind. He's like 22, and I was talking to him about just how well he knew his body, and it was insane. He's like, well, this hip is tight, so I can't run this route on this degree because I'm going to cut it short and I can't get to the right angle. I'm like, this is insane. Like, someone at 22 doesn't usually know this. So it was impressive to see someone that young understand his body that way. Usually the 27, 28, at least NFL, they're starting to decline and trying to catch another contract before they retire. And so they're trying to do whatever they can. Whereas the young guys are just like, I just got here. I don't, I'm fine. So, but if they take the mindset of being proactive, trying to prevent injuries, trying to increase flexibility, trying to increase healing, all in a safe path. There's a lot of doping and a lot of stuff that you can do that is risky and not worth it. And we saw that with Tristan Thompson the other day from the NBA. Like that's the problem. There's so many things. You just have to be willing to invest in your body and find the right places. I get most of my referrals for NFL guys or any professional athletes from the physical therapists that I work with because they're the ones who the players confide in them the most, and the PTs confide in me. So rarely does that player trust you directly. It's rare. It's usually referral from a player or referral from a PT or a different doctor or someone that they trust, and they said, "Oh yeah, I know this physician or he's good." Um, but rarely do they just knock on your door and say, "Hey, I want you to help me." Maybe it happens, but usually they kind of vet you a little bit more. Uh, but when you see how crazy you can do, like I just developed a couple things. One, a basically a complete uh, sports medicine exam, physical, whatever, where I'm doing ultrasounds of most of the body. I'm doing MRIs of most of the body, really good MRIs. You can do genetic testing. You can do, uh, uh, you know, uh, heavy metal testing, which is underrated, and we can talk about that if you want. Um, we can there's different types of gene testing that can give you an idea of how risky you are. There's certain safe supplements that are going to optimize your performance. There's certain medications and supplements that you can take that give you a competitive advantage, something like hyperbaric chamber or red light therapy, or PEMF, or any of these modalities that are safe, that have data to support it, that you just have to do it. You just have to be willing to fit that into your schedule. And the guys that do it, or girls, whatever, end up being the ones that do end up doing well, and more often than not have successful longer careers where they can kind of control their career as opposed to hanging it up because they couldn't stay healthy.
We'll get back to sports medicine, but I have to ask, meeting CD Lamb, is he as cool as he seems? you know,
Yep,
just playing on the
it's
field and
exactly
just
what he
like
looks like. Exactly who he looks like. That's exactly who he is. Yep.
that's awesome. I'll always remember that draft day video. I think his girlfriend took his phone away from him to like
Oh
look through
yeah.
messages or something. He took it back. I was like, dude, I love CD already.
Oh, that was funny. That was famous. Yep, that was famous. And there's a lot of guys that are cool, that are straightforward, and there's some guys that they're a little prima donna-ish or whatever, and it is what it is. Um, and there's some guys you wouldn't even know they're famous. Like, they're just regular people. They just happen to be really good at something and get paid a lot of money because of it. Um, uh, you know, uh, uh, Pivoting a little bit. Um, One of the other protocols that I've developed that is really something that's fascinating to me is more longevity or anti-aging. And we're starting to get more and more data to be able to optimize our health, prevent some of the diseases that what most people assume to be just part of life, a part of aging. Um, if there's certain things that we have to our access, how available, certain testing that you can see when you're at higher risk for XYZ. And if you're willing to go down that route, you can live to 80, 100 and still be super, super high functioning. Um, and you start stealing, mindsets and different tricks from what we call blue zones, or different parts of the world that have people that are well over 100 consistently. And you have different modalities, different peptides, which are mini proteins. You have different IVs. You have different things that you can, different supplements, different extracts from different plants that serve a very specific function, that can decrease inflammation, that can prevent cognitive decline, that can prevent the heart from starting to fail, that can prevent telomeres from shortening, which eventually leads to death. So when you start to put all these crazy cool things together, you can kind of defy the odds. Like, how does that 7-year-old actually look 50 and act and feel 50? Unfortunately, most of it's not covered, so that's where it becomes a little bit restrictive. But um, it's so fascinating, and so the advancements in medicine have come so far. I mean, you can get an AI guided CAT scan of the heart that tells you what type of plaque is soft and which plaque is hard. It's insane. It's like literally insane. The radiologist reading it can't see it, but the AI can, based on just patterns of recognition. It's insane. And we eventually these may become mainstream. They may not be. It depends on if big pharma wants it and big insurance. But in general, if you're willing to go outside the box and check out some of these things, you just all of your assumptions for traditional medicine go by the wayside. Like often I get comments like, why didn't my traditional doctor ever mention any of this? I'm like, this isn't, I see traditional medicine as a horse with blinders on. They do what they know. They do what they've been trained their whole career. You know, I was just at a ultrasound and regenerative medicine course in Breckenridge last week, and most doctors wouldn't be able to go to this. It's 4 days long. It's $3,000 or $4,000, not including flight. Um, and you're only studying one body part. Like, there's no way most physicians that would want to do it could do it. There's no way they would be able to meet their quota for the month of patients. You just can't do it. So, but how are you going to be able to optimize the advancements in medicine if you don't learn how to use them and learn what they are? And learn, well, if you see this, this is what you should do. If you see this, this is what you should do. This is coming out and this is how we use it. If a drug company didn't bring it to you and it's not on the MAR for insurance, you're probably not going to want to learn about it. And that's sad to me. That's why I will continue to do what I do.
So, what are some staying on the topic of living a happier, healthier, longer life? What are some easy things that people can do that they might not even realize could contribute to living, longer and healthier? Some things on a daily basis that they could maybe incorporate that they might
Yeah,
not be
I
doing right
mean,
now.
so it sounds kind of funny, but
Hmm.
when you go back to it, the basics actually still apply. Exercise is very, very, very important. Hormone modulation or monitoring is very important. The majority of older women, we'll say 60 plus, are at higher risk for fracture because their estrogen stops usually in their late 40s, early 50s, and that's the mechanism that prevents them from rebuilding strong bones. They fall, they break a hip, they're at increased risk, and they eventually die. That doesn't apply to men because men aren't dependent on estrogen. If you exercise, you prevent that and you continue to keep that bone strong. You can avoid the traditional trap of all this garbage food. You're eating all these type of canola and all these what we call seed oils. Those are the biggest gimmicks and the most inflammatory things that you could even think about putting in your body. It's like you have inflammation and you just poured gasoline on it. What are you doing? Like, the problem is the food industry doesn't correlate with health. They don't care about your health. They care about making money. Most of the meat is garbage in America. I read a stat the other day or about a month ago that blew my mind. 80% of blueberries have at least 2 pesticides. One of which is called malathion, which is known to contribute to cancer. Blueberries, considered the one healthiest things that you could possibly eat.
I was
The
gonna say I have
problem
blueberries in
is,
my fridge right now. I might have to go throw them out.
well, why do you think they take a decent amount of time to spoil? They
Yeah.
eventually spoil, but because they're picking them and putting pesticides on them to keep them to allow you to get them in the fridge. They're probably coming from Chile or somewhere that's not exactly up the street. So the problem is we're eating garbage food. Gluten is a beautiful example. Our body has no idea what the gluten. It has zero idea. It's not even similar to the mechanism and molecule that it used to be 20, 30, 40 years ago. So it creates inflammation and it lingers. And then we have joint pain. We have all this stuff. We have fluoride that significantly contributes to poor functioning thyroid. And you wonder why everyone has a poor functioning thyroid. Gee, I wonder. Um, and unfortunately, a lot of the treatments, as we mentioned earlier, are just band-aids. When someone gets put on a blood pressure med, do they ever ask when they're going to stop it? The assumption is when you die. That's not a treatment, that's a management. You stop taking it, it doesn't work. That's what I call a management. There's certain things that you have to manage, but ideally you find the source. We have so many different things in our culture that lead to chronic issues. I'll give you another example. Mercury. How many people eat fish? Probably most of them, 60, 70, 80%. I currently have a 23, 24, somewhere on there, professional baseball player. He loves sardines. Weird habit, but okay, fine. We checked his mercury level in his blood, which is usually negative. It's really low sensitivity. It was like double the amount of normal, so it was high, not sensitive enough. So I checked what we call a urine provocation test, which basically means you check the morning urine as a baseline. You put an IV in of a metal chelator that binds to the mercury. You pee it out, and then you collect that urine for 6 hours, and you compare it to the morning. His level was 86 times normal. Why? Because
Wow.
his body doesn't know how to get rid of it. Has no idea what to do with it. It's like, bro, you're stuck in here. That's contributing to poor brain function, poor nerve conduction, all of these accumulating things. And our body is a combination of processes of A plus B equals C. You need C plus D to make E, so on and so forth. But a lot of the metals, a lot of these issues, low vitamins, prevent B from becoming C. So you never get to E. You never get to M or whatever letter you need to get to. And until you can get enough B or remove that metal that's preventing it from happening, you never have enough. So you end up underperforming, under delivering, and your body starts breaking down. That's, in my opinion, accumulation of toxins, whether it's BPAs in plastic, whether it's mold, mycotoxins, whether it's EBV that we've had since we were 12. All of these are different toxins that eventually cause the body to break down, and that opens the door for cancer. That opens the door for Parkinson's or any of these things. And the problem is, none of these things are checked. None of these things are checked traditionally. Of course, you're not going to find them. You're not looking for them. And even if you look for them, they wouldn't even know how to treat them. So, and that's part of the problem, is that most people, they go through their routine physical exam, they're overweight, they're eating garbage food, they don't exercise enough, they're exhausted. It's just, there's so many things wrong that even eating clean is very difficult now. Exercising, eating clean, drinking enough water. Half the medications get pulled after a couple of years because they find out about a different problem. It's like, what you don't even know what to trust anymore. Are statins good for me? I don't know. Are PPIs good for me? I don't know. It depends on who you ask and how long you look at it. So that's the tricky part. Everyone wants a Band-Aid, and everybody wants to get all these beautiful benefits, but they don't want to put in the work.
Yep.
And that's the tough part. Some people are genetically gifted. They smoke until they're 90 and they're still living. Most people, that doesn't apply to. So that's not the most straightforward answer, but you kind of get an idea.
Absolutely. I mean, that was fantastic insight. I've been taking mental notes, and I'm sure when I go back and listen to this, I'll take actual notes to really hammer home some of the things that you said, because you are right, and a lot of us don't even have the time to really sit down and really think about what we're eating on a daily basis. That's kind of the sad part as well, right? Like, we're all caught up with work or something, and oftentimes food and exercise and all that stuff gets kind of pushed out to the end until it becomes the number one problem in your life. And then you're like, oh man, maybe I should really start focusing on what I eat. So unfortunately, that's kind of the cycle that, a lot of us go through. But I think this is a good reminder to everyone to really hone in on the things that you're eating and really taking care of yourself.
Yeah, my goal is to spread the word. I'm actually starting a new podcast in a couple of weeks. Um, that will be available on all the platforms. That is just kind of my way of not really discussing injuries or sports. It's more so talking about all the different various things that I do, and different things that we can optimize. We're going to talk about peptides. We're going to talk about PRP versus stem cells. We're going to talk about how to live to 100. We're going to talk about how to address low back pain. We're going to talk about why ketamine may be a good choice for depression. Things that you don't know about, that health, wellness, anti-aging, regenerative medicine, sports injuries, or recovery. A lot of different topics in the health and wellness space. And I'm going to keep them relatively short and sweet, 20-30 minutes, give or take. so that you understand that there are different options available. And I just want to provide information and educate and hopefully learn something in the process.
I think that's beautiful. This podcast will be coming out in 2 to 3 weeks. Obviously, all your links will be in the description, and if you launch the podcast by then, that link will be there as well. So, if you like what you've heard today from Dr. Morse, then obviously go check out his podcast and go check out his Twitter. I came across your page, and like we were talking about before recording this, I was doing a lot of research and just scrolling through your tweets. There's a lot of gold in there, and a lot of great points. Not even just for for fantasy, at being a big fantasy football player. Obviously, it matters a lot to me. But again, just in some of the general health and wellness stuff, I think is super important. So definitely check out all those links in the description and go check out Jesse's stuff. Jesse, really quick, couple quick hitters before we take off here tonight. Concussions. I just want to hit on that really quick. Concussions are down from 2015. I'm looking at the data right now. 2015 in the NFL, there are 275 concussions. 2022, there are 213. So the NFL is doing something right because there's less concussions. Can you explain to me what a concussion is and what some of the long-term ramifications are? And then last tidbit, how do we get smarter about preventing concussions, specifically in the NFL?
So think of a concussion as a traumatic brain injury. Usually, it's what we call a contra coup mechanism. So it's an impact, and it's kind of bouncing off the skull and the counter impact. Not always, but usually. Um, and it's a significant signal disruption in the brain. You don't have to be knocked out. Only about 11-ish%. I think it's between 11 and 15% of concussions actually become loss of consciousness. Um, the they are overwhelming. They can take over your life in a day. The NFL has done a fantastic job of improving, of identifying, of penalizing plays that would cause that to be. They were after what I called a Tua situation last year, and shout out to him this year for not having one. Um, to um, to realistically pull a player off the field that took a hit to the head. And as the season went on, we started to see more players come back. But initially, they were ruled out. That was it. They were done, even if they were negative, even if they passed the sidelines. That may be player dependent, player specific, depending on how important they are to the field, which is a separate discussion. But um, and they've for the most part, they've been really aggressive. You can use things like something I use in my office called methylene blue. You can use hyperbaric chamber. You can use fish oil. You can use a bunch of different modalities to get you to recover a little bit faster. Um, but they are scary. They're a big deal. And the helmets have gotten better. I think that's part of the role. They may eventually introduce those funky looking concussion helmets that they do in the preseason because the data supports them, even though they look stupid. Um, but in general, they've done a great job. They're continuing to do it. It's a vicious sport. You're never going to remove all of them, but they have significant lifelong ramifications. I think CTE is real. I don't care what any of the Raiders say. The problem is there's a slow accumulation of trauma that end up developing proteins that can develop just inflammation and different signals, and that brain is never the same. It's not meant to get concussed every week, multiple times a year. And then you also have the linemen that are suffering these subconcussive blows, not these big, huge hits. That also plays a role too. So, there's multiple parts to it, but concussions are a big deal.
Is CTE something that's diagnosable, or is that just based off symptoms?
So, unfortunately, technically, as of right now, it's only diagnosed on autopsy. So technically not, but you can suspect it. We've had several people, NFL players, non-NFL players, that have unfortunately passed away. Their brains were evaluated and they were confirmed, many of which died by concussion or suicide. But unfortunately, it is not. Obviously, we can make assumptions Um, and we may end up being right, but you might not be able to prove it for many years.
Mm, interesting. Um, two more topics, and then I promise I'll let you go. The I said we'd come back to Aaron Rodgers really quick. Your opinion on Rodgers, that whole that whole cycle of news about him coming back, 3 or 4 months after tearing his Achilles, all of that stuff. What was your opinion on the whole Rodgers situation?
So in general, the Achilles is a very significant injury, regardless of the position. Did he tear it? Yes, no question. The video was clear as day. There's no question. Everything was coordinated. He literally moved mountains for his physical therapy. That is a 6 to 9 month recovery, probably closer to 12 months for most people. The fact that he was even remotely coming close to 4 months is absolutely insane. I know Cam Akers did it in 5.5. Cam Akers was 21, 22, and he looked awful when he did it. The tissue is not meant to do what it does. They did a more aggressive approach called the speed bridge. They used stem cells that's been confirmed. Um, and he did every modality that you could probably think of. A lot of the stuff that I do in my clinic that most guys probably aren't willing to do. He also had the luxury of not having to be a super mobile quarterback, and it happened on his plant foot or his front foot, not his back leg. So it's more of a guidance than it is a push off, which is the kind of the difference between Cousins and Rodgers. But in general, do I think if everything was applicable here, I think there's a chance he could have come back. Would he be one hit away from a new injury? Yes. Was he going to have trouble with mobility? Yes. But would he still had the brain? He still has the arm. So he had that going for him, but uh, it didn't really matter. So that was it. But in the end of the day, the effort was legit, and if his goal was to remain relevant, he did a fantastic job.
Here's to hoping that Rodgers comes back next year. Love watching the guy play football, and I'm hoping he's back to where he was before the injury. I think that insight between the plant foot and kind of the foot that get all the power from, so the other foot. I think that was incredible because I never thought about that. Just as a casual fan, someone tears their Achilles, I never really think about what foot it's on. But especially for the quarterback, I think that distinction
Yeah,
is key.
that's one of my concerns with. I tweeted about this today, actually. One of my concerns with Cousins is that I don't. People are just going to assume everything's going to be perfect. Um, he might have a little bit of issues if he can't push off and generate that velocity that he's looking to fit the ball into tight windows and over players' heads and so on and so forth. He may be fine and everything may be perfect, but um, this is a tough injury to come back from. He's going to move mountains to try to get there, but this is a tough injury. And he has the head, he has the shoulder, just like Rodgers, but can he generate that force and push off that side? Think the easiest way I'll compare it is think of how much Joe Burrow struggled because that was his push off leg and that was a calf. That wasn't Achilles, that was calf. And think about how much he struggled. And he re-injured it 6 weeks later or a month or whatever it was.
Yeah.
So extrapolate that significantly, and you have a guy that's 10-ish years older. There's a couple things that are maybe a little bit of red flags, and you can't just assume he's going to be the same player and is going to be another 35-40 million dollar contract.
Great insight. Jesse, as we wrap up, we have to end as we do with all of these episodes. And the way that we end this is every guest, I ask them for a piece of advice that they leave for our next guest without knowing who it is. And so our last guest on the show was a man by the name of Jamie Beckler. He is a leadership coach. He's worked with teams like the Raptors, the Milwaukee Bucks. He's currently working with the Bucks. And his advice for you was your role as an influencer or someone with a platform. It's your responsibility to find solutions, to move people forward, to make others better, to make situations better. I mean, that's perfect. What does that mean to
Yeah,
you?
yeah. I mean, it's the truth. You never really know who you're going to influence, who you're going to impact, and unfortunately, we're held to a higher standard. I guess as a physician, I am as well, but and that's part of it. Everyone, in my opinion, should be held to a higher standard. Whether or not you uphold that standard is, I guess, a different story. But But yeah, that's beautifully put. I guess my advice, completely off the top of the head, um, is if you can help it for your own health, be proactive, not reactive. Don't wait for something to break before you fix it. Anticipate and try to get ahead of things. It's a lot easier to fix a minor issue than it is a moderate to severe issue. Once the heart has suffered a heart attack, you can't go back and unheart attack it. It don't work that way. Same with a stroke, same with anything significant. If you have the luxury of the resources, whether it's financial or whatnot, be proactive. You'd be surprised. There's tests that can check for 50 types of cancer with a single stick of blood. It's called a Glary test. There's a lot of cool things that you just may not know about that if you did, it may save your life or someone you loved life. And if someone is suffering from something, don't be afraid to look for non-traditional options, because even if your physician isn't recommending them, that doesn't mean they don't exist. It just means they may not know about them, or they may not be allowed to talk about them. We get with the type of physician I am, we get suppressed a little bit. Big Pharma doesn't want to hear what I have to say. The FDA doesn't like to talk about what I have to say. So just because I can't talk about it doesn't mean it doesn't exist. So if you want something, you just leave no stone unturned when it comes to that, because health is wealth. You can have all the money in the world. Allah, Steve Jobs. It doesn't matter if you're dead.
It's a great point, and a fantastic way to end this episode. Jesse, before we leave, we talked about your podcast. Is there anything else you'd like to plug or point people to?
No, I mean, obviously I have patients. I work in probably the Miami location, but we have several locations. The name of my clinic is the Osteopathic Center. If you're looking for something outside the box, in general, the easiest way to reach out to me is probably either Twitter, if you can get through, or Instagram. But if you have questions, if you're looking for help, I try to help as much as I can.
Love it. And like I said, all those links will be in the description. So we'll link to your center down in Miami, and all your social links will be in there as well. So Jesse, this has been a fantastic conversation. I appreciate your time, and thanks again for coming on.
Thank you very much for having me.